Please introduce yourself.
Hi, I'm David Lukoff.
And I'm Christel Lukoff.
And we are going to talk about the workshop we will present in Moldova by first introducing ourselves. So I live in California, where I am a licensed clinical psychologist, and I'm a professor of psychology at the Sofia University. You may have heard of it when it was called the Institute of Transpersonal Psychology. And professionally, for the last 30 years, I have been interested in the overlap or the interface of spirituality and clinical practice. Much of my personal work has been on spiritual emergencies. And I've been involved in getting much more acceptance around the world for people having spiritual crises and spiritual issues that are important in their recovery from mental health problems and in their well-being. And the workshop we will be teaching is more focused on issues around death and grief and illness. And I have been a health psychologist in a hospital setting for 14 years, the San Francisco VA. So I have worked with people who have HIV and AIDS, who have chronic and terminal illnesses, and who are in fact dying. So that is the foundation for my personal experience in this area. And I will be largely presenting a lot of the scientific research that deals with issues of spirituality and clinical practice. So let Christel introduce herself now.
Hi, I am a licensed psychotherapist here in California. I actually got training both in Germany, my home country, and then in California. I work in very practical ways. I work as a psychotherapist in private practice with people of all ages and different presenting issues. However, in the last 16 years, I've been specializing in working primarily with people with life-threatening illness, chronic illness, and end-of-life issues. For these 16 years, I've also been working in a palliative and outpatient hospice organization. So in that capacity, I do home visits to individuals and their families, wherever their private home is. That may be visiting an elderly person with a life-threatening diagnosis and for support and psychosocial issues as they are approaching their dying time. And my role is to support not only the ill person, but also the family and the whole system to guide them through this time and help them live their life to the very last day in meaningful ways. So I will be drawing in this workshop a lot from my practical work. I am, in addition to being a psychotherapist, I also work as a storyteller and include the arts. Part of our workshop, and we'll talk a little bit more about it, will include different approaches in the therapeutic setting.
What will your presentation at EUROTAS
So maybe
be about?
we can describe a little bit. Yeah, so in the workshop we will be giving, we will focus on the spiritual issues that people face in dealing with death and grief and illness. And I think this is an under-recognized issue. is that when people are dealing with illness and imminent death or loss of a loved one, it's not just on the psychological level. It brings up questions of meaning, of what's important in life. Has my life been meaningful? What can I do with my remaining time that will be meaningful? So people are often not just concerned about, pain medication and, bodily functions and so on, but there is this whole spiritual dimension that has really been ignored in psychology. So we really try to focus specifically on those spiritual issues. I think the psychological issues are well documented, but that's why we try to focus on this ignored area. So there's a lot of scientific research at this point in time that I will review in the workshop on what kinds of spiritual issues people face, what helps support people during these kinds of life transitions, and so on. And we try to do the workshop in a way that is very experiential and really gives people a kind of a taste of the spiritual dimension of dealing with death and grief and illness. And I'll let Christel talk a little bit about some of the work she does with folk tales and stories that I think really facilitate this kind of work with spirituality.
And our approach is very much, as David said, not just learning with our left brain, but also experiential learning in different modes of experiencing it for ourselves. And what does spirituality, what does meaning and purpose mean in our own lives? Because if we have a strong sense of that in our own lives, we're able to assist others with these questions. So the workshop is very appropriate, not just for professionals working with people who are dealing with illness, with loss and grief, and facing maybe they're dying. But the workshop is also appropriate for people who have a very strong personal interest in these topics, who may be dealing with their own personal struggle with aging, illness, facing the grief of a loved one who's passed away, the aging of their parents. We are all in the same boat. This is an issue that we all, at one time or the other, will be faced with in our own very personal lives. So that informs our approach to not just learn techniques, so to speak, and ways on working with others, but bringing ourselves in as a person in our own humanity. That is a strong part of what spirituality is about. So I will be drawing from my experience in my work as a hospice therapist. We'll be bringing in a lot of case examples, specific stories about people that I've met and what has supported them throughout this time. I will also drawing from my wide collection of traditional folk tales. I've collected probably about 200 traditional stories and myths that specifically talk about grief, loss, illness, death, because these are issues that are part of being human that we're all faced with. And we will see in stories from different cultures how the details may be different, but the grand themes are very much the same across cultures. The other part we want to do as part of the experiential experience is we will create a ritual space together. There will be time for partner exercises and a lot of sharing in the group. we will bring in images and the arts because and as well as music, because these are modalities that take us into a different space. We will include mindfulness practice as part of the day, and maybe a little time to reflect individually, do some writing, and then share in the group again. So, you know, specifically, we will teach people how to do a spiritual assessment, how to conduct a meaningful life review, how to assist people to write what is in the literature called an ethical or spiritual will. So there are going to be many experiences that can assist us in our own journey navigating these times in our lives, as well as working with clients or patients in professional settings.
Right. And this is a workshop that we have given around the world, in Japan and Scotland and Mexico and Brazil and many other countries, and we've given it at conferences, and we find that people really value the opportunity to reflect on their lives and the end of their lives. And many who are therapists or nurses can integrate what we teach into their work, and many other people find it very satisfying to have another transpersonal perspective on issues of death and grief. So we're hoping that we will see you there, and although it's a very serious topic, we also spent a lot of time in the workshop taking care of ourselves. Some of the stories that are in the folklore literature are actually quite humorous and give us another perspective on death and grief that is not the normal one. And there's a lot of opportunity for sharing in the workshop, because this is a topic where it's really not possible to be a true expert. We can all learn from each other in this area. So we hope you'll come and we'll create a little learning community together.
And that you can share what you learn in this workshop with your workplace, with your loved ones, and in your own life, in a way of bringing the heart and spirit into your life, into your workplace, into healthcare. Thank you. We'll see you in Moldova.